Here is what to do if your baby or toddler is choking. First of all, do they have a strong, effective cough? Are they able to take a big breath in and a strong cough out? If they're able to do that, you encourage them to keep coughing. So strong, effective cough, encourage them to keep coughing so that they can clear that object. Where we need to intervene is if they don't have that strong, effective cough, where it might just be weak, or they may be silent. What you need to do, take your baby out of the high chair or whatever it is that they're in, and we are going to lay them across our lap. You can do this with a toddler as well. We are holding them firmly so we don't drop them, and their bottom is higher than their head. So we're trying to get a bit of gravity here. Between their shoulder blades, with the heel of your hand, we are going to give up to 5 back blows. Now, of course, we are also calling for an ambulance. We need help to arrive. So you can either pop them on speakerphone on your phone or get somebody else to call while you start doing this. Up to 5 back blows. 1, check. 2, check. 3, check. 4, check. 5, check. So we're checking in between each back blow to see if that object has come out. If it comes out, we can stop. If the object has not come out, we are going to turn them over, and on the hard breastbone, so this part here on that hard breastbone, the same position that we do CPR, we are going to give up to 5 short, sharp chest thrusts. The idea is we are forcing the air out of the lungs behind that object to try and pop it out. You can use 2 fingers on a small baby, or you may need to use the heel of your hand for an older baby or a toddler. So 1, check. 2, check. 3, check. 4, check. 5, check. And if it hasn't come out, then we go back into our back blows. 1, check. 2, check. 3, check. 4, check. 5, check. And we continue 5, 5, 5, 5 until either the object comes out or the child becomes unconscious. And if they become unconscious, then we are starting doctor's ABCD or CPR. Now, if you don't know what that is, you need to do a first aid course and watch our other video on how to do CPR. When it comes to prevention, there's the 4 S's of choking prevention. First of all, we need to supervise our kids when they eat. If we keep them in our line of sight, we can intervene quickly if needed, okay, because choking can be silent. We get them to sit down to eat. That's the second S. And the second S is all about sitting there, concentrating and being present with our food, because they are more likely to choke if they are running around and not concentrating. The next one is shapes. We are going to cut up their food into appropriate size pieces. For example, we're not going to give them those whole grapes and those big whole blueberries that are those perfect spheres to get lodged in their airway. We're going to chop them up into quarters. With the carrots, we're going to chop them up into sticks like the sausages as well. Make sure that they're an appropriate texture too, so they're nice and soft when they're first starting, so they can chew on these, but it's not that perfect circle to get lodged in their airway. And the next one is search. We're going to crawl around on our hands and knees in our house, and we're going to find all of those little objects that pose a choking risk. Anything that can go through the cardboard insert of a toilet roll, a child can choke on. So we need to make sure that we get those little things out of the way. So let's recap. If they have a strong, effective cough, we encourage them to keep coughing. If they have an ineffective cough or they're silent, we give back blows and chest thrusts. And these are Australian Resuscitation Council guidelines. With our back blows, we are doing them between the shoulder blades with the heel of our hand. And you'll notice that when I was doing those back blows, that I'm not whacking them on the back like this. The idea of what we are doing is that strong, forceful back blow that is forcing the air out of their lungs behind that object to hopefully pop it out. We give up to 5 of those. Obviously, we stop if the object comes out. That doesn't work. We are going into our chest thrusts, same spot that we do CPR, on that hard breastbone in the center of the chest, but they are short, sharp thrusts. Once again, trying to force that air out of the lungs to try and pop that object out. And we keep going 5, 5, 5, and so on until either the object comes out or they become unconscious. If they become unconscious, we are doing CPR, doctor's ABCD. So make sure that you follow CPR Kids for lots more tips and tricks when it comes to child and baby first aid. And if you've got any questions, please don't hesitate to pop them in the comments below and we will answer them.